Welcome. We're so glad you're joining us. COVID, flu, allergies, respiratory issues. When you feel crummy, you just feel crummy no matter what it is. No one wants to waste time sitting in a waiting room or going to several different doctors, especially if you're in pain or sick. It's best if you know ahead of time a plan of care so you can start feeling better. Should you take your family to primary care, an urgent care, or emergency? And what can you expect when you get there? Our friend John Stewart, who is not only a nurse but an administrator for Hurley's Emergency and Trauma Services, is going to help you out, save you some time, and get you back to feeling better. If you have any questions for him, he'll answer them live. You can text me questions, text don't call, at 248-935-2562. Or you can post questions on Facebook or YouTube and we'll get them there too. John, we have a pretty good track record for patching people up, but it helps if you know where you should go.
Indeed it does, and to your point, if you have these types of questions, you're certainly not alone. If you're experiencing mild symptoms such as temperature below 101 degrees, aches, pains, mild cough, etc., those that could be caused by the flu, COVID-19, and you feel the need to be seen by a doctor, calling your primary care physician should and would be most beneficial. Always encouraging people to touch bases, make an attempt to call their primary care physician. They're really the captain of the ship, and the people that they need to be the provider that gives you that direction. Many primary care physicians are now offering virtual visits and can assess patients by phone or video call fairly frequently and quickly. For more immediate or after-hours care, a trip to an urgent care clinic can be a great solution. Unless it's a true emergency, urgent care is generally a better use of a patient's time and resources. Hurley urgent care locations are open 7 days a week, have a far shorter wait time than the traditional ER, and cost much less than a traditional hospital emergency room visit. Our urgent care clinics have advanced diagnostic imaging like X-ray and lab capabilities to assess your illness or injury on site. Urgent care providers can prescribe medications and recommend a higher level of care if needed. Always remember this, and I think this is a salient point. If the urgent care provider thinks that you need a higher level of care, they have the ability to escalate that care, and by ways of their connection can facilitate transfer to the emergency room with a little bit more efficiency. When to go to the emergency room. Certain medical conditions are considered emergencies because they require rapid or advanced treatments, including surgery, that are only available in a hospital setting. You know, we always try to promote, and this is some information that we're sharing, but always err on the side of caution, and in case of a true emergency, remember to always call 911 or go to your ER with life or limb threatening injuries. Some examples of when to go to the emergency room. I've listed out a few here. Asthma attack or severe shortness of breath, broken bones protruding through the skin and dislocated joints, coughing up or vomiting blood, facial lacerations, major lacerations requiring stitches, fever with rash, head injury, which could result in concussion or confusion of any level, loss of consciousness, such as fainting, seizures, or change in mental state, paralysis, poisoning, serious burns, cuts, injuries, or bleeding, severe allergic reactions, swelling lips, difficulty swallowing or breathing, signs of heart attack. What are those signs of heart attack? They're pretty broad, but the traditional chest pain, chest tightness, any pain radiating down, frankly, either arm, your jaw, or around to your back. Anything that causes additional difficulty in breathing, you should be seeking the emergency room. Signs of a stroke, such as sudden weakness or numbness on one side or slurred speech, sudden and severe headache, suicidal or homicidal feelings, vaginal bleeding, or severe abdominal pain with pregnancy. Again, always pushing for you to call 911 or go to the ER when life or limb are at risk. What to expect when you visit the emergency room. I've kind of laid this out just as a means of explaining kind of what that visit's going to look like from beginning to end. And when you walk in through the doors of the Hurley Emergency Department, you'll see the check-in station in the waiting room. The amount of people waiting to be seen in the emergency department ebbs and flows, and if you come at a peak time, it might be very busy. Remember that everyone is there for a variety of reasons, and the staff are trained to help you get seen as quickly as possible. At Hurley Medical Center, we are the Level 1 Trauma Center. We're the northernmost Level 1 Trauma Center in our state. And that means to you is that critical patients are constantly arriving via helicopter and ambulance. Due to the unpredictable nature of medical traumas, we must see the most critical patients first, which means there can be extended wait times for non-critical patients visiting the ER. Getting you started once you get there. After you arrive, you'll be greeted by a registered nurse at the greet desk who will ask a few questions to properly identify you and the reason for your visit, which will then be utilized to initiate a patient medical record. After check-in, you'll see a triage nurse who will want to discuss further your reason for coming to the emergency room and your symptoms. Your vital signs such as your blood pressure, pulse, and temperature, pulse ox will be taken. The triage nurse will determine the acuity scale or level of severity of your visit. This ranges from a level 1, which is the most life-threatening, to a level 5, which is the least life-threatening. This stratifying patients as they arrive helps the emergency department prioritize and determine what level of urgency best aligns with your condition. While all patients, of course, are important and will be seen, some require care a little bit more quickly than others. Most patients are then asked to return to the waiting room. Next, you'll be seen by a medical provider in an appropriate space in the emergency room. Most of the time, people are placed in a room, but you might be evaluated in another treatment space within the emergency department, depending on room availability and the staff's ability to provide care in alternate treatment areas. So I alluded to the stratification or determining the level of urgency you're at, and I've listed here some of the categories. So we evaluate patients and place them in 5 different categories, and a level 1 is the most urgent, and an example of those types of presenting patients would be those suffering from severe heart conditions like a heart attack, stroke, severe bleeding, poisoning, head or spine trauma. A level 2 we quantify as very urgent. Examples of a very urgent patient care visit would be severe fractures, severe allergic reactions, high fevers, those fevers above 104, 105, and serious burns. The level 3 we categorize as urgent. Examples of an urgent care patient visit would be a seizure, fainting, head injury, or broken bones. Level 4 is a little bit less urgent. That would be those patients that might require stitches, have suffered from strains or sprains, may have fallen with minor injury, and or those that might have urinary tract symptoms. And then level 5 is the least urgent, and examples of that would be the cough, congestion, eye infection, rashes, ear infections, etc. When to go to the urgent care. Urgent care clinics are for when you can't wait for an appointment with your doctor, but you don't need an emergency room. Urgent care is for injuries or illnesses that are not life-threatening. Again, I would reiterate the importance of reaching out to your primary care physician and get some direction prior to making the decision on your own. Hurley Urgent Care offers same-day treatment for minor illnesses and healthcare needs for both adult and pediatric patients. They're also ideal for something, if something happens outside the normal business hours, those 9 to 5 hours. Hurley's urgent care clinics are open from until 10 p.m. on weekdays and from 10 a.m. till 6 p.m. on weekends. Symptoms that are best evaluated in urgent care include abdominal pain, upset stomach or vomiting, acid reflux, allergies, bronchitis, sinus pain and infections, bladder infections, painful urination, colds, sore throat, cough and congestion, constipation or persistent diarrhea, dehydration, ear infections, fevers without rash, mild flu-like symptoms, minor burns, minor cuts requiring stitches, pink eye, red eyes, discharge or itchiness of the eyes, pulled muscles, sprained strains or tendinitises, rashes without fever, skin disorders that include bug bites or stings, sexually transmitted infections, severe toothaches or abscesses, some wheezing or shortness of breath, or workplace injuries. Excuse me. What to expect when you visit the Hurley Urgent Care. Upon arrival, you will check into the reception desk. After checking in, you'll be asked to have a seat in the waiting room. Where does your care go from there? As soon as the provider is available, you will be called back to an exam room. The medical assistant will take your blood pressure and temperature, assess your symptoms, and ask a few questions about the reason for your visit. Shortly thereafter, the provider will come in to diagnose and determine the treatment you needed for your particular presenting complaint. After the provider has completed the examination and offered a treatment plan, you'll be asked to check out at the reception desk. When to use our virtual urgent care. Virtual urgent care can be the right care environment if you have a minor to moderate medical problem that can be solved without visiting your doctor, an urgent care or emergency room. It can also save you significant time and expense. Adults and children age 5 and older can video chat with a care provider while at home, work, or on the go. This service is for patients who have minor medical conditions. I've listed some of those minor medical conditions which are consistent with some of those presenting at a regular urgent care, and those include such things as allergies, sinus pain, infections, coughs, colds, eye infections, flu symptoms, those are the minor flu symptoms, food poisoning, low-grade fevers, those are the fevers of under 101, skin conditions, bug bites, rashes, and urinary tract infections. You might ask, how do I start my on-demand video visit with a Hurley urgent care provider? You can request a virtual visit online at hurleycarenow.com, or if you encounter any issues, you may contact the urgent care staff at 810-262-2710. Here's what you would expect at a virtual visit, and it's pretty simple, it's pretty straightforward. Your visit may start with a brief wait in a virtual waiting room. Once connected with a provider, you can expect a safe face-to-face confidential visit with a care that's very personalized. And I think with that, I've kind of gave the whole overview of what to expect and how to determine what treatment destination is best for you.
John, maybe you can touch on just the fact that all hospitals in the state right now are experiencing high volumes. So when you come to our emergency room and you may face a wait, it's going to be probably like that wherever you go.
Which is really why we're trying to put this information out to the public and share. We have protocols that we put in place. We've enacted our capacity protocols. We've expanded care spaces to see patients in unconventional areas. And to your point, this case is prevalent. It's very pervasive throughout our community, the state, and the nation. It's really predicated on this influx of these respiratory diseases, and so although we've made concessions to try and expedite care and make it as efficient as possible, I think understanding where your alternatives lie might give you quicker, more efficient access to the care you need.
If you're in the emergency room and for several hours, let's say, and you feel like your symptoms are getting worse, will they reassess you?
Yes, we do have a process in place that a provider rotates through the waiting area, triage area, and does serial reassessments. Of course, family and patients advocate for themselves and can check back in with the triage staff to have reassessment completed, and at that time, we can escalate your care if your condition warrants it.
Someone's asking if I've already checked in and been triaged at the emergency room, will I be charged for the ER visit if I leave and go to your urgent care?
We make every effort to not incur that expense. Sometimes there's some alterations that we have to make on the backside to do that, but with the proper communication, we can take care of that.
I saw someone in a Google review recently that was surprised that they were brought in by ambulance and were triaged and then sent to the waiting room. Just because you're brought by ambulance doesn't mean that you aren't going to end up waiting.
Correct. That's a very good point, and I think it's a misconception. Your acuity is still going to be established by the medical care team at the hospital, and regardless of your mode of arrival, there'll still be a system in place to evaluate your level of urgency.
And the staff at Hurley, being a level 1 trauma center, I mean, these are people who are very trained and experts in emergency care. So if somebody comes in and they're waiting, they might be like, I shouldn't have to wait this long, or what if something happens? They're keeping a good eye on where you stand, and they're not going to just let something happen to you. I mean, they know who they need to get back right away, and this is something that you've developed over years and on a lot of practice.
Yeah, I think you're positioned most favorably in our emergency department as a result of our advanced training, and as being a verified level 1 facility, the American College of Surgeons has sanctioned us as an organization that has the expertise to assess levels of illness and respond accordingly. And so we all want our care as quick as possible, and it's miserable to feel sick, but we do have staff in place to assess your level of acuity or sense of urgency and deliver the care as needed.
Some people, I think, are worried if they go to urgent care, then the urgent care is just going to send them to emergency, so then they're, just added more time into the process.
Yeah, I think that's another value of this discussion is to, hopefully provide more information to the public on how to make that determination. But, I think at the end of the day, it's important to seek care, understand your options, and I think it's okay to go to an urgent care, and if that care needs to be escalated, and as a result of our connections with the urgent care and our emergency department, we have the ability to expedite that and make that transition most efficiently.
And most people, I think, want to go to the right place, so just having this information just arms them so that they can heal the quickest that they can.
Correct, and I think we always try to encourage people. We have, healthcare is very available. We have a lot of alternatives in our community, and so at any point, you shouldn't suffer. You should seek care. We're just trying to outline perhaps where care can be most efficiently accessed.
Okay, sounds great. Thank you so much, John. Appreciate it. Thank you, everybody else, for coming and checking us out and seeing what you can do to make your healthcare experience a little bit better. We hope you don't need any of these services, but if you do, Hurley is your destination for expert care in this region, which includes Mid-Michigan, Northern Michigan, and the Thumb. Thank you to Mid-Michigan Now for being our broadcast partners. Have a great day, everyone.